Welcome to a discussion today of disinfection technologies for COVID. And as young Kim is going to point out early on in his presentation, the new evidence is that the coronavirus is airborne and, in fact, travels long distances, and inefficient masks and filters are actually aerosol generators. So the ability to address that question is going to be worth trillions of dollars. And as we see here today, we've got very large numbers of deaths, past 200,000 here in the United States and many around the world. And so disinfection has got a great role to play. And we have two speakers today that are going to provide two different approaches to it that actually can be complementary. And then we'll be getting into the applications for both of those that aren't necessarily covered in the presentations themselves. And I'm going to ask the speakers as they make their presentations to introduce themselves, give us a little background of what they're doing. Our first speaker is going to be young Kim, of associate professor of the Weldon School at Purdue, but that doesn't do justice to all his different titles and the activities that he has around this. So, Young, when you do start your presentation, please give us some of that background as well. And then Robin Collins will be our next speaker. And she may also be joined in discussions by Charlie Rodriguez and some of the other people from Patho3Gen. But she's the VP of sales, and they have a very interesting method for sanitizing shoes. And I think it's very complementary to a lot of the other disinfection technologies. So with that being said, let's move on, first of all, to Young's presentation. And so let's get the full slideshow up here. And Young, would you like to give us a little of your curriculum vitae before we...
Right. My name is Young Kim. By the way, thank you so much for this opportunity to share some of our projects in the lab at Purdue University. I'm an associate professor in Weldon School of Biomedical Engineering at Purdue University. My research interest is quite broad. We're doing some optical imaging, and another active project in the lab is mobile health, mHealth, and also spectroscopy imaging. And we are also doing some biomaterials in silk and fluorescence proteins and etc. And this research about the photodynamic airborne therapy, it's based on optics, so it's kind of related to what we do in the lab. So as you know, coronavirus can float and be transmitted in the air. So in other words, the coronavirus is airborne. There's a strong evidence, scientific evidence, and also some of the agencies, CDC, acknowledge it, and then actually they pulled back a little bit, kind of back and forth. The reason is that I think we don't have a good solution to tackle this problem. So let's get into a little bit about details airborne transmission. As you know, the coughing and sneezing on an infected person can produce virus-containing droplets. It's actually the size matters. So if thinking about big droplets, then just fall immediately. So wearing mask and etc. is really important. But let's say we have some aerosols smaller than 5 microns, then they can really travel far. And some of the study pointed out they can travel even up to 16 feet, even more. That means when we are in a confined space or enclosed space with poor ventilation, then there's a risk of infection. So again, the key point is without something propelling, coronavirus aerosols can float and spread in the air. So having this in mind, our technology is based on photodynamic therapy. For short, it is called PDT, is a well-known cancer treatment for certain type of skin cancer and esophageal cancer and etc. It has detailed mechanism, but let me simplify. So basically, we need to have two non-toxic components. Number one is light. We use green light or white light, so we don't use UV light as a light source. And we need to have a photosensitizer. So photosensitizer is exposed to light, then actually they're excited, and then they kind of interact with oxygen in the air and the humidity in the air, and then they generate reactive oxygen, in particular singlet oxygen. It's more like a oxygen-free radicals. If you want to understand this better, you can actually think about a detergent. Sometimes we use some oxygen-based, for example, OxyClean kind of a detergent. They generate similar reactive oxygen species so that we can actually do our laundry better. So basically, we want to use a singlet oxygen to inactivate or neutralize viruses. And scientifically, it is well established that the singlet oxygen can destroy or damage many different vital functions, in particular the membrane, the lipid membrane. Given that coronavirus is an envelope virus, and singlet oxygen is known to be very effective for inactivating envelope viruses. So that's the whole idea. You can change this slide. So there are medical, very effective and expensive photodynamic therapy photosensitizers. But the idea is that they're good, but it's not cost effective. And we want to actually generate this to cover a large space. So our idea is that to use something else. So we identified a few FDA-approved food coloring dyes can serve as photosensitizers. So you can click a button and it'll show some of the cases. So there are many different types of FDA-approved food coloring dyes, and we identified a few, and in particular, red number 3, just red dye. It's very effective to generate singlet oxygen. Basically, those are edible photosensitizers and very cheap. If you compare to a medical grade photosensitizers, that's like 100 times cheaper than some medical ones. You can flip the slide. So these are some of the food dyes that we tested in the lab, and I think you can just click many buttons and you'll see all of this. Again, the key point is we can just use green light, and the green is the wavelengths in the middle of the white light. And so again, we don't really use any UV light as an activation source. And then using some of chemical probes, we confirm that we really have oxygen, singlet oxygen generated when we shine the light. And this is one prototype, and we can have a tablet type, so we don't have to carry a big water that has photosensitizer, in this case, red number 3. And also, it lasts quite a long time. So it depends on the saturation and concentration and then the power of the light. But in our laboratory study, we tested that it can last for about 3 to 5 hours. Next slide. And then another important aspect of this technology, by the way, we named our technology Photodynamic Airborne Cleaner pack. The size of aerosols of a PDT aerosols. The magic size we determined is 5 microns. If the aerosol size is too small, then there's a chance that we might inhale, so that get into the lung. But if size is greater than 5 microns, then there's not much issue about inhalation. And also, if size is too big, then they don't travel too far, because we again want to cover the entire confined space. So we determined that actually 5 micron is an optimal size. So to generate such a size of aerosols, we realized we can use the ultrasound transducer. It's the frequency determines the size of droplets or aerosols. So we can tune the frequency to have about 5 microns of aerosols. And then the image on the right is actually the imaging. So it's called the shrink imaging because we are talking about very small droplets and aerosols. It's kind of hard to see under conventional photos and videos. So we use this imaging method. You can actually click the link and see. No. Can you click the address, the bottom? Yes. Hopefully a video pops up.
Yeah, I think, oops, let's see.
Oh,
Potential security problem. You want to continue? Yes. Or...
yes, just give it a try and see.
Yeah, sure. Mm-hmm. So one question I have is we're waiting for the video there. You're generating 5 micron droplets, but aren't they starting to evaporate to smaller droplets?
Right. So that's actually a good question. And so that's why we need to have a diffuser keep generating those aerosols.
And so as they evaporate, more are, yeah, here we go. Uh-huh.
Right. So this one, so at the bottom we have a generator, and it's not clear from just this image that how far it travels. But now we are turning to shrink imaging, and you can see the small aerosols travel really far. But again, I sorry for not having the scale bar. So this is a quite big scale. And actually, if you move on to the next slide, you'll see an actual product. We have several showcases. So you can again collect the bottom of the address and can.
Yeah, maybe better get out of this one maybe first. So yeah, I better get out of that one. Okay, and then we go to that. Yeah. Uh-huh.
Just for our demonstration, we had 3 different types, more like a desktop, and we attached a portable one on a robot, and also to a drone. So you can see that we have a PDT solution and then generated, and then we have a light source inside. Again, we need a light to activate. Otherwise, there's no singlet oxygen. So the light is important. We can use sunlight or room light, or in this case, we have our own light source for using a green LED. So the idea is that this can be placed in a confined space or enclosed space where we have relatively poor ventilation. Then we have a way to sort of neutralize airborne viruses. So you can move to next slide.
But before we do that, then you've got a drone up here in this particular image where you're moving it around the room. Is that what we're looking at there?
Right, yes. So we are thinking about, let's say we have a performance arena or something, then in order to cover a large space in a short time, then one way we thought, use a drone system to diffuse the aerosols in an effective manner.
Yeah, that's very, very interesting. Yeah. And then you wanted to move on to the next slide of that?
Yes, please. So some comparisons. I think there are some effective technologies out there. The most effective one is, as we know, deep UV, particular UVC. It is well known that we can deactivate or kill airborne or surface viruses, but the problem is the carcinogen. So people cannot be present during this application. And there's some other cases. Actually, we are going to hear about steam, ozones and steams and etc. I think the petathrision, and they're effective. But again, we wanted to have a technology that when folks are in a confined space, we want to have some active mechanism of disinfection. So these are simple kind of table to compare some more things. I think ours is very unique in some sense in terms of light source. Again, we are using green light or white light, and the active ingredient is the FDA-approved food coloring dyes. And we are generating relatively, large aerosols, so that we really want to minimize any risk of inhalation, getting to the lungs. Okay. So we've done some value proposition. It's kind of exercise for a business model and anything. So there are several pains nowadays. We have stress and anxiety whenever we go to a space where we have poor ventilation and etc. And now our activity is limited. At Purdue, we return to in-person classes. So my practice is try to open the windows every time and etc. So if you click one more time, you'll see product. So given that we are using singlet oxygen, so there's a high possibility that we can really reduce airborne infection and transmission, so that we can reduce the stress and anxiety. So we are thinking that can be used for all kind of indoor settings, gatherings, worship, places of worship, performance arena, even public transportations, and etc. Okay. Next slide, please. So we have two provisional patent applications. So within in a year, we have to convert to a full patent applications. We have some scientific papers, but this one is instead of using food dyes, we used fluorescence proteins, so all edible. And luckily, we received some small funding from Purdue University to make many of this. Actually, now we are conducting a collaborative study with a national lab to really see the efficacy against the airborne transmission of coronavirus. So we are going to do some animal studies at first. So we have to make many of these devices. So hopefully within a month or so, we can launch this animal study, and hopefully within this year, we'll have some scientific result that PAC could be useful for inactivation or the neutralization of airborne coronavirus. And last slide, one thing we have to be aware of is this regulatory issue. We are getting into kind of gray area of FDA approval and EPA approval. Depends on the exact applications. Let's say you want to use this in the hospital settings and etc. Then it's under FDA regulatory guideline. But if you're thinking about general kind of utilization, then it's more EPA guideline. But unfortunately, at this moment, EPA doesn't have a clear guideline about airborne disinfection, although they have a very good guidelines for surface disinfection. We spoke with some of scientists at EPA. They're actually thinking about putting something for the to guide airborne disinfection. But anyway, our technology is kind of getting into this gray area. And that's why we really want to make sure that the safety is not a concern. So the size of aerosol is important, and also the light source again is important. So that's the kind of current stage of our development, and we're discussing this technology with some big companies. making some of our diffusers and perfumes and etc. So hopefully we can translate this to a product in a real relatively short time frame, because this is a time-sensitive development. Okay, thank you for your attention. And so it's kind of interesting study in our lab, combining some of optics and photodynamic therapy and making small devices.
Yeah, very.
I'm happy to take any questions and suggestions.
Yeah, very interesting, and certainly I invite questions from any of our listeners here. I'll start this out. One thing that occurs to me is you've got FDA and EPA, but I think also the OSHA it would be a good format to be using in terms of, for instance, there are many industrial plants where you have to have a mask or some other precautions in order to be working in a space. And I guess I'm a little concerned on the fact that even though the droplets are 5 microns, they're going to be smaller as they move through the air. But it seems to me that anybody who's wearing a mask is going to be protected, is wearing an efficient mask is going to be protected. And therefore, using the OSHA type standards, that you would be able then to be spraying the aerosol, regardless of the people in the vicinity or the evaporation rate of the aerosols. So this seems to be an area to pursue, would it not?
Right. Excellent point.
And so I think the crux of the whole thing is you've got something that is going to be safe when it is being used in areas where people are actually working, as opposed to having to vacate the space in order to do it.
Right. That's the whole point of it. That's the motivation of this actually invention. So we wanted to have some mechanisms that when folks are around, that we can reduce the risk of airborne transmission.
And I don't think it's that difficult from a management standpoint that anybody that's in the area where this is going on wears their mask. I think that's, and particularly, with the trend now, we're getting, not only is our government authorities now saying you should wear a mask, they're starting to say you've got to wear an effective mask. So it would seem that being the case, and I also see the rather than look at this as something that is a protocol that's throughout time, it's one that's basically fluctuates with time. That, say, in an office space or something like that, you wear your mask, during when you're moving away from your desk, or when the aerosol is being injected, you take it off, where if you're at your desk and social distancing and nobody else around. So it seems like there's a number of parameters here that where this concept will have a lot of advantages.
Right. So actually, excellent point. A combination of face covering and this device could provide some freedom to us. Right.
And unlike the H2O2 and other things, you definitely don't want people in the area where it's being ejected. So this seems like a very interesting development.
So we are looking for any partnership, industrial partnership. If we have somebody, or if anyone is interested in, we are happy to work with. In a university setting, it's kind of hard to scale up in a short time. So we really welcome any industrial partnership to move on. Again, it's a time-sensitive situation, and if this can be used to reduce the airborne transmission in any settings, I think we'll be really happy. We are not really caring about making monies. I think we just want to help out using this technology.
Well, that's very, very admirable, but it does seem like you've got a real winner there. And the one last question I had, well, you tell us a little bit more about the cost of these, because those, I think you used some numbers that were per gram, right? Those food dye costs.
Right, the food dye is very cheap. You can buy a big bag, and also we are using very low concentration. Actually, I didn't mention any details about this, but we are using red dye. So if you put a lot, that means there's a chance of staining. But actually, just using small size of aerosol minimize staining, surface staining, and also we are using light that actually generate. So generation of singlet oxygen is a photo degradation process. So through this process, actually it loses color. So we don't have much issues about coloration over dyeing surface. Anyway, so we're using very low concentration of food dyes. So that's very cost effective. And as you know, the generating aerosols using ultrasound transducers is really cheap. And even we purchased some small components from Amazon for $5, even less. So overall, it's and also the LED, as you know, is very cost effective. So overall cost is very affordable, and that's actually the concern, and kind of straightforward to make it. So some people said, oh, after you gain some attention, and some of companies, in China, will just make duplicates and then sell it. So the one problem we have is too simple.
Yeah, I see that. One other last question I had too is, what about injecting it in HVAC systems?
So we never thought about any combining to other systems, but yeah, I think I have to learn more and other systems that can be augmented with this device.
Yeah, and a little later we're going to show things like checkout counters where instead of partitions there is laminar flow air directed from the HEPA filters, and it would seem like this would be a very good device for some of these companies. I'm sure they would be very interested to talk to you that have these systems. So we'll be showing about that in a minute. But in the meantime, we're going to move on, and we're going to talk to Robin, and I'm going to move back to the beginning of her presentation here. But by the way, thanks very much for that, Kim. That was a very interesting presentation. So let's get this slide show up here, and let's see. Start from the beginning here. And that was a very good presentation by young Kim. Now we're going to hear Robin Collins of Patho3Gen. And Robin, would you give us a little of your background as well?
Sure. Thank you, Bob. And Young, I was very impressed with your innovative photodynamic air cleaner. It looks extremely promising, and the timing right now, it's very critical. So well done to you and your team. My name is Robin Collins. I'm with Pathogen Solutions. My background is primarily in the medical device and pharmaceutical industries. I began my career with Merck and with them for a little over 10 years, and then I moved on to work for a company called Guidant. The last 10 years or so, I've been working with early stage startups, and Pathogen Solutions is a early stage startup company. We launched the technology last year in February. That was when the first hospital adopted the technology, and they have seen a 53% reduction in infections as the result of adopting the technology and other infection prevention measures. So instead of talking about air, I'm going to be talking about surfaces, and in particular, floors and shoes. Our technology is a shoe sanitizing station. It uses a combination of UV light and ozone in order to completely eliminate coronavirus and kill up to 99.999% of infection-causing pathogens in seconds. If you go back one slide, please, Bob, just want to take you through the multiple certifications. If you can just back up one, please. We are certified by NSF Applied Research Centers out of Ann Arbor, Michigan, and we are EPA approved and registered. Additionally, we are UL certified, both here in the United States and in Canada. And recently we received our CE certification so that we can distribute in Europe to the EEA countries. Our manufacturer is ISO 9001 certified, and our technology is made here in the US. The majority of the components are US made, and our manufacturer is in actually Tampa, Florida. Thank you. Next slide. So what are we trying to help to solve? A number of things. We're offering an additional layer of protection for employees and end users, excuse me. We're also trying to keep production plants open and producing, and ultimately working with the food and meat processing companies, helping to prevent recalls. Last year in the United States, there were 173 Class 1 recalls. And on the average, food recalls cost a company anywhere from $10 to $30 million. Usually the larger the company, the larger the cost. What you may not know is that the bacteria count on shoes is significant. On the average, a pair of shoes has more than 421,000 bacterial units. Research has also found that 96% of shoes had fecal bacteria on them. And the transfer of the bacteria from the shoe to the floor is between 90 to 99% with every step. What we also know, as Young mentioned, is when people sneeze and cough, they produce droplets, and those droplets fall on the floor and on shoes, and they're carried virtually everywhere. We also know that E. coli, Listeria, and Salmonella can double in 20 minutes. And at that rate, in 7 hours, one E. coli parent cell can produce up to 1 million pathogens. Next slide. So why floors, why shoes? Why is this important? This was a study that appeared in Infection Control and Hospital Epidemiology in 2016, the primary authors being Drs. Koganti and Donsky. What the researchers did was they took a non-pathogenic viral marker, placed it on the floor of 10 patients' rooms, monitored the spread over a 3-day period. What they found was, as soon as day 1, it had spread from the floor to 100% of the patient's footwear, and literally all over the patient's rooms, including on the patient's hands, on the call button, on the doorknob, on chairs. They also found it in adjacent rooms, in the nurse's station, and on portable equipment. And this persisted for the full duration of the trial, which was 3 days. So what we know is what's on floors and what's on shoes quickly and persistently spreads everywhere. Next slide. So what is industry doing to adapt? 2 major companies are investing significantly, including Tyson, that spent millions of dollars to keep their employees protected. And in 1 month alone, they spent $120 million on bonuses to keep their frontline workers and their production plants open. Their CFO, Stuart Glending, says it's very important to make sure their employees are healthy and are able to work, and it's top priority for their company. Hormel also has invested significantly. They expect to spend $80 million on changes to protect their employees in the next 6 months. Additionally, they have instituted on-site testing for COVID and has spent more than $100,000 in implementing this testing. So this UvZone shoe sanitizing station uses UV light and ozone. It can be set at 6, 8, or 10 seconds. It's super easy, plug and play. It requires no additional staff and can provide continuous 24/7 protection or continuous clean. It can also be relocated easily wherever it might need to be used. And it yields approximately 4.5 million treatments per year, assuming continuous on. We do recommend that the bulbs be replaced once a year. So next slide, please.
Let's see, we're going on to the next one.
That's it, very good.
Yeah, I get it. I think we'll better expand it again somehow. It knocked us out of the slideshow there, so get that back on the current slide. Sorry, system slide, current slide, present.
I think it's
Current.
the second. I think it's the second from the left, Bob.
Yeah. See, resume slideshow. There we go.
That's great.
Okay, there we are. That was the right one, was it? Yeah, let me go back. There we go. Up, backing out of it again. Huh.
So what this slide is showing, as Bob's queuing it back up, you can still see, it's showing the potential microbial low dispersion of pathogens if you don't have a way of stopping the pathogens from entering your facility or key areas within a facility. And then the second slide shows that by placing shoe sanitizing stations at entrances and in key areas, you can limit the pathogen dissemination. If you can put it back in the
yeah, let's see if we can get the
I think it's that
from the current slide. Let's see. I think let's see if that. There we go.
Perfect. So here's somebody standing on the shoe sanitizing station. What's great about the design is you can go from a contaminated or dirty area, stand on the unit, and then walk into a cleaner, sterile area. The person's just stepped on the unit, and then that's when it's activated. Bob, if you can just push enter, it should show the animation.
Okay.
If you push it, and perfect. So only during the activation are the UVC and ozone being transmitted. A wait light comes on, the unit quietly counts down 8 seconds, and then the unit beeps, signaling the person to be able to walk forward into a clean area. It truly is just that easy. Next slide. So let's talk just a minute about login percent reduction. As you go up in login percent reduction, you go down in the number of colony forming units or pathogens. The assumption is you start with 1 million pathogens. The majority of the available products kill between 99 to 99.9% of pathogens. What this means, however, is that anywhere from 1,000 to 10,000 pathogen units are left behind. With our technology, you can get up to a 5 log reduction or 99.999%, meaning only 10 pathogens are left behind. And with coronavirus, it completely eliminated it. In the next slide, it shows a comparison of if you were to use just UVC light at 8 seconds or our powerful combination of UVC plus ozone. And what you can see is for MRSA or Staph aureus, the results are somewhat similar, but with things like C. difficile, which are spore forming, you only will get an 85% reduction with UV light alone, which means almost 150,000 pathogens will be left behind. With our technology, you can get up to a 99.944% reduction, or in other words, UVC plus ozone allow the technology to be 263 times more effective. With human coronavirus, we're able to get up to a 99.98% reduction, or in other words, ozone plus UVC is 24.5 times more effective than using just the UV light alone at 8 seconds. Next slide, please. So in food processing, in addition to COVID being a concern right now, E. coli, Listeria, and Salmonella are all issues. What we know is this technology is proven to kill E. coli in 8 seconds at a 3.56 log reduction or 99.972 reduction, which is almost 5 times more effective than using UV light alone. All 3 of these bacteria have similar levels of vulnerability in similar environmental conditions and have similar ozone and UV light receptors. And both ozone and UVC light alone have been shown independently to kill these pathogens. And clearly by adding the ozone, UVC plus ozone is much more effective. So here is the coronavirus study done by CREM Labs. They tested the technology at 6, 8, and 10 seconds on coronavirus 229E, which is the EPA recommended surrogate standard for testing products to combat COVID-19. They had 3 separate test challenges, and they found at 8 and 10 seconds to completely eliminate coronavirus. This next slide shows you the results of the NSF trial, that the technology is effective in killing Candida auris, a fungus, as well as multiple other pathogens, including E. coli, MRSA, C. diff, etc. Next slide. So let's talk just a little bit more about the ozone. Ozone is a gas. Ozone puts small holes into the cell wall and cracks the outer capsid. Then the ozone and the UVC working together are effective in killing the pathogens, and the UVC denatures the cell at the DNA level, thus resulting in these extremely impressive kill rates. Next slide. So the CDC cites within hours after disinfecting floors, they're nearly back to pre-treatment bacterial counts. And why is this? Several reasons. One, because pathogens regenerate, whether you use floor disinfectants or UVC. In addition to that, people start walking on the floors again, people sneeze and cough. What's great about this technology is it does limit regeneration and denatures the DNA. Next slide, please. So we've had multiple employee engagement surveys conducted, and what we've learned by the results is 90% of respondents felt safe that they wouldn't be taking pathogens home on the soles of their shoes when leaving work. 97% of the respondents thought the shoe sanitizing station was easy to use, and 89% of respondents agreed that the addition of the shoe sanitizing stations made their facility a more attractive working environment. Next slide. So we offer a number of different value-added complementary support materials and services, including expert recommendations on where to place units. We're happy to take someone's floor plan and provide recommendations. We offer customized marketing materials, including signage, social distancing floor stickers that can be placed 6 feet from the unit and 6 feet from each other, as well as large banners. We work with a public relations firm called Pratt Communications. They can help craft press releases and get media coverage, both locally and nationally. We can provide the facilities with employee engagement surveys and live dashboard results to share with the team. And we offer financing options to suit any budget. So in summary, we believe our value proposition is strong. The technology is scientifically proved to be both effective and safe. The unit is very easy to use and can provide 24/7 continuous clean. Do you have any questions?
Yeah, questions from the floor here. And yeah, I might start out by asking you the value. It seems quite a bit of value of leaving the facility and using the sanitizer as you leave. And I would imagine, particularly I'm thinking of a meat processing plant or something like that, you're going to have, as these shifts change, you're going to have, there'd be a lot of use of it as the shift comes in, but there would be a lot of use of it as the shift goes out too. So it does seem to be quite an added value here.
Absolutely, Bob. Yeah, we actually hear from employees that I think they're even more excited to use it before they go home than when they come to work.
Yeah, you certainly can see that. Speaking of going home, we're all trying to struggle on why these Asian countries have had such a low incidence of COVID relative to United States, and the custom of taking your shoes off before you enter a home in Japan, for instance, is pretty standardized. I wondered if you'd had any thoughts about uh, that fact, in a way, indirectly proving the value of what you're doing.
Yeah, well, we have a motto, leave your outside shoes outside if you don't have a shoe sanitizing station. But absolutely, I mean, the one case study we have at Advent Health Connerton, the hospital that instituted 8 units, they've seen a 53% reduction in healthcare associated infections over a 13-month period. And that's as the result of utilizing the shoe sanitizing stations and, of course, other infection control measures.
And it certainly should have widespread usage of it. I mean, the unit is not all that expensive, is it? I mean, from a standpoint of how big a group of people have to be using it to justify it, in your opinion?
Well, depending on the volume of units purchased, it can cost anywhere from less than $13 a day to less than $8 a day. So it is very cost effective, and it's a heck of a lot easier than using either sticky pads or technologies that use chemicals to clean the shoes. And there's much less risk of slip and fall with this technology as compared to those that have wet chemicals.
And you showed some pneumonia numbers in one of your other slides there, and
Yes.
I think we're trying to put together the hospital infections, the influenza, other viruses, air pollution, and COVID, and a lot of these things, and yours in particular, wouldn't necessarily affect reducing the air pollutant related contamination, but it certainly would be for the influenza. And it's amazing around the world, how many cases of influenza there are, how many deaths, and so forth. So I would think whatever applies to COVID would certainly apply to any of the other viruses, and influenza in particular, would it not?
Absolutely.
So multiple benefits. Yeah, I'd like to thank Robin, and let's now move on to maybe some of the specific areas there. So I'm going to go back to our daily alerts, and the way we've got it set up here, you can go in to our daily alerts. Let me just open that up here. And so we go into subscriber login here, and going to bring up this page. We have 70 or 80 or different publications or so. So it is quite a number of them. And this is our subscriber login page. And anything to do with air is in this particular area. We do have pharmaceutical solutions, by the way, too. So we're looking at all the plants that are putting in therapies and building vaccines and so forth there as the solution. But then this is the coronavirus. And you can go in here and search. So you can search, for instance, under meat processing. And what I'm going to do is basically show some pictures. But before I do that, I just want to make sure that you're all aware of how you search this. And so you can see there's many 38 results on the meat processing plants here. And then you can click going in this way on any of them. and then do the same thing for schools and other areas. But what I'd like to do is just to maybe go through some of the more, maybe we're gonna have to start the other way around. Start with September 25th here, and we'll work backwards. And so let's even start with a checkout counter here. And Young, what I was thinking is that if the checkout counter had a periodic injection of the food dye, maybe when there aren't customers there or something like that, to clear that area would be appropriate.
Right.
And for Robin, certainly, have you looked at grocery stores and other areas as places? But certainly, if it's only if the number $12 or $13 a day, you're not talking big numbers.
Yes, we've talked to a couple of chains. We're not yet in any grocery stores, but we remain optimistic. Probably the ideal place would be just as entering and exiting.
Right, rather than the checkout counter. So yeah, but I was thinking entering and exiting. And we're going to get on more on meat packing, but there's one thing if you can see this here, is the worst possible thing a lot of these meat processors can be doing is to be putting partitions between each worker here, because all it does is create, if you visualize this as perfume, all you're doing is creating turbulence, and your perfume could stay in the air much longer than if it just wafted through. So without some other laminar airflow, you've done the wrong thing here. And then here's film studios, and again, it would be the entrance and exit, but they all need to get back into production. And here you have laminar airflow. So again, Young, from your standpoint here, if you have this injected into this laminar airflow system, it would seem to be pretty effective. So that let's move on then on to July 30th.
Robin, by the way, the combination of ozone and the UV is really a good idea, because you can really target both pathogen functions at the same time. I think that's the reason you have very high, like low 5 scale disinfection rate.
Thank you. Yeah, our inventor, a gentleman named Asher Gill, is a pretty bright guy. Sadly, we lost him this year. He passed, but yeah, he was brilliant.
So that's an interesting point. Yeah, that combination is pretty powerful. One thing I wanted to show you here is to just get some idea of how much money might be worth spending. I mean, getting children back in school is, worth hundreds of billions of dollars a year. And this is the ultimate. Every child and every desk could have its own HEPA filter system here. So, the suppliers of this argue that compared to paying for someone to take care of your children while you're working, if they can't go to school, this is a bargain to have your own HEPA filter system here at the school. So, what both of you are talking about is a lot less expensive than this kind of money spent on every school child.
Agree. All of these are just another layer of prevention, but what Young and his team have come up with is pretty amazing.
And you have young, particularly with the orientation being with a university, obviously that would be the first point of use, right?
Right. Any classes or places of worship, and we see some potentials, and definitely we know that as a scientist we need to show scientific result that really are effective in activating and neutralizing coronavirus. So again, hopefully by the end of this year we have some strong evidence with the collaboration with the national lab, because we don't have a facility to handle coronavirus on campus. So luckily we formed the this collaborative study. Yeah.
Are you using it or planning to use it on campus?
Yeah. So if everything is proven, then happy to place in any classrooms or lab spaces. Yes. So but as you mentioned, there's a big issue. I think if you really want to place this in some common places, then we need to have EPA approval for safety concerns. That's my understanding.
Oh, I see. Okay.
Mm-hmm.
Now, another application would be dental offices or other offices here, and certainly for the Purdue approach here, even injecting it into the ventilation systems. If you had laminar airflow, it would be a possibility. But Robin, from your standpoint, people going home may feel more comfortable if they're leaving a dental office and there's a foot sanitizer, that anything that their feet picked up there isn't going to go home with them. And wouldn't that be a good argument?
Absolutely. Yeah. Plus also, I mean, when you're in the dental chair, knowing that additional layer of prevention has been provided, I think should be a nice visual sign of safety and security. Because as we sit in a dental chair, we put our feet on it.
Huh, that's another thought I hadn't had as well there. Yeah. Now we moved on to elevators, and certainly, Robin, from your standpoint, it would seem to be that in a big office building, the entrance and certainly at the elevators themselves might be a very good place to be placing the sanitizers, would it not? I mean, you have to sit around waiting for an elevator. Going through the sanitizer might be a good place to do it.
It's a great location, Bob. We've had people ask about putting it inside an elevator, and we don't recommend that because it's a confined space. Yeah, putting it outside of an elevator is a great place to put it.
And Young, from your standpoint, another group there at Purdue does have a contract with Otis Elevator to figure out how to make the elevator as safe as possible. Are you going to be collaborating with them?
No, I'll look into it. This is the first time I'm aware of this technology. Purdue is a big university. We have so many things going on campus. Yeah, so I'll look into it, actually. Thank you so much for the information.
Yeah, actually, it wasn't for any particular technology. This is a Chinese technology we're looking at, but elsewhere in our alerts here, we report on the fact that Purdue's got a fairly big contract from Otis Elevator to guide them to make elevators as safe as possible. So that's a contract I think that was just awarded here a few weeks ago.
Oh, okay, wonderful.
Yeah, but it would seem obviously that the two groups should be talking to each other. But there is a lot of activity in Asia, and this is a whole HEPA filter air system that's available from KLC there. And again, the idea is to keep the COVID out of the breathing zone. So the air enters the bottom of the unit, comes out the top, and so forth there. But I think that's another thing to be looking at. And let's go back to May 5th then. Again, we're looking at the meat processors, but also what happens at a meat processor when you put these partitions up, you get these cavities and you get turbulence and so forth. So it's not really a good show. Again, you've got big box stores where there's this opportunity as well. So these are all, I think, opportunities. And so let's move on. Let's see to May 5th. Oh, this is the one we just did, isn't it? So the last one was April 17th. And this is the meat processors, and I think for both of you, this would be a huge opportunity. First of all, you know, the number of people that are involved in this business is huge. This is just in the United States here. You can see hundreds of thousands of people that are involved actually in the processing itself. 227,000 food processing, but meat, poultry, and fish cutters and trimeters is 117,000. So these are big numbers, and the companies that are involved are large ones, and as Robin pointed out, they're spending quite a bit of money to try to solve this problem. And again, you've got the plant entrance where your food sanitizer, foot sanitizer would be placed, and again on leaving. But then again, throughout the plant here, in terms of the use of the food dye system, it seemed like this is a good place to do it. But the other thing would also be in the offices and the lunchrooms and things. Have you talked to people about those locations, Young?
No, not yet.
But certainly that would be. They found that a lot of the transmission probably was occurring in these large lunchrooms. So that's another area there. So looks like lots of opportunity for very interesting technologies that both companies or both entities are involved in. Did anybody have any other comments or thoughts they'd like to make before we close today? If not, I'd like to thank our two speakers and look forward to continuing conversations with both of you.
Very
Thank
good.
you so much.
Thanks a lot, everybody. Bye now.
Thank you. Stay well. Bye-bye.
Bye-bye.